So I'm Mike Desjardins, CEO of Virtus. Welcome back to another podcast, Conversations with Leaders. I'm truly honored to have Dr. Gillian Simonett with us here today to talk about burnout, and in particular to talk about systemic burnout. Gillian, maybe I'll get you to tell us a little bit about your background and what brought us here to talk about systemic burnout. Like how did this come about for you? So we start a little bit by who you are and what you do and where you work and all that kind of things to provide context to our viewers. And then we can dive into the conversation.
Okay, hello, thank you. So I'm Gillian Simonett. I'm a physician here in Vancouver in physiatry, also known as physical medicine and rehabilitation. I finished my residency in 2011, and during my residency, I became interested in the idea of burnout. That's when I gave my first presentation on it. I've been now in practice now for about 10 years, and burnout has become more and more discussed and openly discussed, perhaps, in the field of medicine, with more and more research going into it, both directed at the healthcare workers themselves, such as physicians and the rest of the team, but also in identifying and treating patients and that we work with as well. So my more recent presentation, fast forward 10 years later, gave a recent talk on it, again, to the same group I did 10 years previously, and it was fascinating, the change of approach. Before, it was all about burnout and all the negativity and what you can do to change it. Fast forward 10 years, now it's more wellness, looking at systems, different ways to try to prevent, but also to address it in a larger picture, not just at the individual level. And so it's nice to see that there's been a lot of growth in this area of research.
I think you bring up a fascinating point. I've always, I've experienced burnout in my life. I've had a number of friends that have experienced burnout. In the past couple of weeks, I've talked to a number of CEOs and leaders who said to me, "I'm done. I'm running on fumes. I'm burnt out." And I hear them and I feel for them. I've had my own felt sense of experience around that, and seeing how long it's taken me to recover from that throughout my life. And I guess the thing that I face, and I think that other leaders have faced in conversation with them, is that it feels like I've done this to myself. Like, so I'm failing at being an entrepreneur, being a CEO, being a leader. I'm burnt out. And I think that part of this social media challenge now is that I don't get a sense that anybody else is burnt out. So like, this is just happening to me and I'm failing at life. Like, I'm not a good adult. And I'm curious.
Curated social media.
Yeah, right. And I think, I guess my curiosity is that as we move from, to talking about burnout as something that I did, I screwed up my life somehow and now I'm burnt out, to talking about, what systemic burnout looks like. Before we dive into that conversation, I'd love to get your perspective on what are the mental, the physical, and the emotional symptoms that a person would experience when they're in burnout, in classic burnout, so they would be able to maybe do a little bit of self-diagnosis of where they're at right now.
Well, part of this interest in burnout actually has been reflected in more recent, the World Health Organization has actually outlined a definition of burnout. And that's really important because before there was there's a lot of overlap with mental health, such as depression in particular, but also anxiety. But that was also causing some confusion on how to approach it and what you might be expecting and when to be concerned about it being something beyond or different to burnout. So more recently, they have defined it as a chronic workplace stress that has not been successfully managed. So what I really want to emphasize with that, chronic stress, workplace, and that's going to be a big differentiation, and then not properly managed. And I want to emphasize, don't just assume that's because of the individual, but from the organization or the system point of view as well. So it's two approaches. When you're asking to answer more specifically your question, what does that look at? They went further and talked about 3 areas that you might have categorized. The first one is exhaustion. They used to emphasize emotional exhaustion, but this can also be physical exhaustion. This can be, you might have GI side effects, you might have pain associated with this overwhelming exhaustion. That is one area they look at. The second area is more of this emotional, this detachment, this feeling numb, feeling cynical. You hear about being very cynical. And if you're looking at a workplace, this might be your detachment from your colleagues. It might be a detachment to your clients, not really caring about the outcome of what you're working on. So that's the second area, this emotional component. And the third one is kind of a loss of your efficacy, so your professional ability, but that also might be reflected in your change to your purpose. You're finding meaning in what you're doing. And this can change. This last one is kind of challenging because what used to give you a lot of purpose, you might be stalling. And this seems to be related to lack of creativity and lack of output. So all these together are elements that you may find in burnout.
I've had this experience. The words that I would have used is, I would say, I'm exhausted. I just feel tired. And no matter how much I sleep, I wake up in the morning and I still feel tired. And I think, well, I'm supposed to sleep 8 hours. So I went to bed at the right time and I think I slept enough, but I woke up and I still felt exhausted. And, I'm working during the day and I just don't have the same kind of mental clarity and energy that I want to have. And, I haven't had caffeine really in any large amount. Well, I basically went cold turkey April of 2011. And the odd time I'll have a tea with some caffeine in it, so I don't use caffeine to regulate my energy. And I know when I'm in that burnout place, I start thinking about caffeine as a solution. And as soon as I start thinking about that as a solution, I'm like, that's not good. And I think that third piece around the efficacy that you bring up is really interesting. My personal experience has been that I will use words like, I resent. And then I'll sit back and I'll think to myself, well, I have a lot of freedom and flexibility to choose what I do during my day. Why do I feel resentful towards my own company or my own role when I was a part of building this? And it's a very odd experience to be in that place and to have that drop in motivation, which is just not how I show up in the world. And to be trying to operate in that way and then showing up, whether it's for my team or showing up for clients, showing up for my wife and daughter in a way that is consistent with how I want to show up, and the amount of energy that's required to stay present and to show up for them. It actually adds on to that feeling of exhaustion. That's my experience of what you've just described. And I'm curious if you face that personally in your own life, or with the people, clients that you've worked with, is that the similar type of thing that you hear, or are there other manifestations that you've seen?
Well, certainly from a personal or talking to my colleagues, I see that spectrum. We talk about,
right.
It's starting to be something that is addressed more and more. In fact, more recently, our national organization for medicine has really focused on that as a priority. Before that, you kind of have to name the beast. So you have to name the beast to be able to discuss it in a safe and supportive environment.
And so before the beast was, I didn't mean to cut you off, but before the beast was,
allowed to admit it.
Oh, okay. So
I don't think
it's
so.
happening. We just don't talk about it.
I have to tell you, I remember the fear of, so I was a resident, so you're not exactly, you're still in your training phase. Right. And to go in front of a conference room of colleagues, most of which are practicing physicians, and discuss this, that was a bit of an interesting choice on my part, because it was kind of suggesting that there was weakness here. So that I was discussing. So I was quite nervous. In fact, I brought in the big guns. I brought in somebody else to be able to talk about physician health and to help, because I felt I needed a little extra assistance with that. But it is a very challenging thing to admit, especially if you're in a culture that thrives on not admitting any weakness. In medicine in particular, you're supposed to be the one caring for your
Mhm.
patients. So to admit that I too need to address some things on myself is not always available to you. Although it is so talked about now, starting at residency, hopefully, and beyond, that at least now it is something that naturally comes into conversation more often.
And that
However,
feeling of, go ahead.
yes, no, however, I want to make sure when we talk about resilience, I want to make sure when we talk about how do you help prevent it on yourself, I'm not just adding yet another to-do list. You know, somebody says, I've come to you, I've told you I'm exhausted,
Yeah.
telling you I can't achieve all these things, and you just gave me another list of things to do. So it's not meant to, what did I not do? What was I failing at? Okay, yet another thing. So we have to be a little more creative on how do we approach that.
It's fascinating because my experience of this, one of the most poignant times I was I was visiting a friend in Dubai, and I was going like really on my way towards burnout. This was in 2010.
Mhm.
And he said to me, "Hey, do you want to start doing P90X with me as a workout?" And I said, "Yeah, I feel like I don't have the kind of energy that I feel like I should have at this age. And I need to do something." And so I started doing P90X, and that workout program, thinking if I double down on my exercise, that'll give me the energy that I need. That was just pushed me faster down the slide into the burnout. And because I needed something to do, like I as as a sort of driven person, as you say, I needed an action. Like I needed an action. I'm gonna go fix this for myself. And it wasn't until probably about 3 or 4 years ago that I read a book by Greg McKeown called Essentialism.
Mhm.
And he had a wonderful concept in there, which I'm still working on. And his concept was that we say a lukewarm yes to many things in life that we should have said no to. And we get to these things and they build up and they build up and they build up. And then we start to resent the fact that we've said yes. And his concept was we need to actually start getting better at inaction. The inaction is not doing these things. And what that requires is saying no. So saying no to most of the things and opportunities that come forward to us so that we can say a hell yes to
Right.
the few things that really matter and provide us a ton of leverage. And I remember finishing that book and looking at my calendar and realizing how many things I'd said a lukewarm yes to, because I felt socially obliged to say yes to them. I
Right.
felt that I was going to let a friend down by saying no to them. I felt that there was a familial expectation of me to say yes to certain things. And I had to learn how to get better at saying no, which is an odd thing because more action feels like, to me, and I think this is a trap, more action feels like progress. Doing
Mm.
more things feels like progress. And I can see, based on what you're saying, that's actually getting in the way uh, of of healing from being in that place of burnout. So let's talk. So you brought up resilience. So I'm
Mhm.
really curious. What are you learning about how resilience and systemic burnout? Like, walk us through that. What's the connection between resilience and burnout and systemic burnout?
Well, resilience is the individual's ability to be able to manage the stress in a more healthy, adaptive, flexible way. And I'm sure there's lots of examples of when you were quite resilient. And so it's something that you work on. Hopefully, you have practices that help you maintain that resilience as much as possible. When you are in a higher level of resilience, you're in a healthy place, you're sleeping as well, you have strong relationships, you have meaning when in your work, when there's that. We're all going to have ups and downs. There's no way I'm trying to recommend, certainly not medicine, that every day is going to be utopia. That would be disappointing to have that expectation, because it's just, I can't imagine it happening.
Right.
But your resilience is higher. Your resilience is higher. Your vulnerability is protected a bit. If you are lower in that, and we do naturally fluctuate up and down, but if there's been lots of hits, that have made your resilience go lower and lower, you're going to be more susceptible to these. Let's just expect that we're going to have moments of great stress or great difficulties at work, whether that's part of the job, having to break bad news, having a disappointing outcome to a project that you worked very hard on. The resilience is going to be important on how you're able to deal with that moment to moment or over time. So that's kind of a preemptive, that's a protective, that's something you can hopefully try to do before you're in that point of burnout. Once you're in burnout, certainly that's ways we can talk about how to climb back out, but it's going to be much more challenging than if it's something that we were able to acknowledge, identify, and be able to commit to or find priority in that. I love that you have warning signs, and yours might be the caffeine. Somebody else might have maybe the sleep is their trigger, whatever they have recognized. But for you able to recognize it, that means you were really listening, you're observing, you're looking at what your weakness, or I don't want to say weakness, but you're identifying what your little flag is that's saying maybe it's time to pull
it's back. It's like the canary in the coal mine.
Absolutely, right? Absolutely, yeah.
And so you're in an opportunity where the person is in burnout, and I'm in burnout, and if I'm driven, I want to go, well, teach me about resilience. I'm going to go do resilience like things, and I'm going to build up my resilience right now. But what I hear you saying is, no, actually you're burnt out. So I'm going to teach you some ways, I'm assuming, to relax and recover and recharge, to deal with the circumstance as it is. You're in burnout. And then we can start talking about how to build resilience for future, to help prevent the burnout from happening. So let's talk about the warning signs, I think, because I think that part of having great resilience is having the self-awareness and recognition that I'm getting close to my limit. And, bouncing up against that limit, I'm assuming, is not the best thing for us to be doing on a regular basis, like waiting until we have a full manifestation of burnout. So what do you see as a process? So is it one, self-diagnose or be able to, check off the checklist. Yeah, I'm having these things happening. I should put these practices in that are more gentle, more restorative practices, and then start working on my resilience. I think that's what I heard you say. And then if I am not currently in burnout, now would be a good time to be building up those resilience muscles to help to prevent me from even getting there in the first place. Is that a good way to think about it, or?
Yeah, that's a great way to think about it. I do want to take a moment. I wouldn't be a proper physician if you're in that burnout or that phase.
Yeah.
If I'm seeing somebody, it is still important to consider other mental health issues. I do want to emphasize that there is overlap with burnout and depression. If at any time somebody's feeling self-harm, suicidal ideation, that you need to get help at that point. That is a big flag that we're now talking more in depression mode, or at least it's not something that I want you to try to do on your own. Like, that is a red flag. Other hints that this might be more depression is it's more global. It's not just work. So that's where they're really trying to emphasize this burnout definition, this workplace. In fact, it's categorized under occupational phenomena, not necessarily mental health, primary disorders, but under occupational phenomena that obviously affects your health. But the idea is, if you can take a step back, and maybe even when you have hopefully your 2-week vacation or something, and a little distance, and you can say, oh yes, things have changed. Now, you still have to go back and address the work stress, but it's not the same as something that is more of a global presentation. So that would be helpful to differentiate. Another one is hopelessness. Hopelessness is one of these areas that tend to be more on the depression side. So
I think it's a very good distinction. We were running a session last week, and on resilience for leaders, and there were 80 leaders on the call. It was an hour and a half, and in one of the feedback forms, one of the leaders actually said, I appreciated learning about resilience. One of the things I'm struggling with is personal mental health issues. And I'm struggling to understand what is me building up resilience and what has to do with mental health. They didn't particularly say depression. I think it's a very good point that you bring up, and I appreciate you differentiating between burnout and depression. So that people know where to go. And so if somebody is in that place and they're unclear, I don't know, I feel like my resilience is taxed right now. I feel like I'm in a place of burnout, but they start to, I think, use the word globalize. So all of a sudden, it isn't just about feeling burnt out at work. Like, I feel burnt out in life overall. What's the first step that you take if you're not sure whether this is a depression that's setting in, or this has to do with burnout? Where do you go?
Yeah. From my point of view, hopefully you have a primary physician or going to a physician, just to make sure that you have that differentiation. There's a whole workup for depression as well, looking at other medical issues. So you want to make sure, especially if this is your first experience with it and you have having a difficult time differentiating. You gave the example, for example, that you have cues that you're going down your burnout. So if that might not need necessarily every single time, because you've gone through that process again. But if you're in doubt, at least have that piece addressed. Just because there might be I just don't want to put everything under burnout, just in case there's something that can be a little more concerning, especially if you're getting into a strong negativity. It's more about self-esteem rather than, I'm very distant, I'm numb to my work, I don't want to be here, I'm exhausted. That's commonly discussed in burnout. More negatively, hopelessness, that might be, you're now dancing more with the depression spectrum. So just to be mindful of which camp you might be in. But I would recommend, if possible, starting with your physician, especially if you're doing unhealthy activities, unhealthy thoughts.
Okay.
Beyond just not sleeping well, but actually,
So alcohol, drugs, not sleeping. So things that are coping mechanisms. So, because I guess there's good coping mechanism. I'm assuming things like meditation and freeform journaling, float tanks, anything that feels more massage, anything that's kind of relaxing the body as a coping mechanism would be supportive. Whereas, alcohol, drugs, those sorts of things are not going to be supportive in helping to pull us out of burnout.
Yes. And those are all things we all talk about all the time, but if you reflect on yourself when you're in times of stress, look, what happened to your exercise regime? What happened to your sleep? Are there certain foods you tend to go towards? And then obviously alcohol and otherwise. So looking for those cues, that would be a trigger. Okay.
So we've talked about what to look for in burnout. We've talked about the difference between burnout and depression. We've talked about the cues that we want to look out for to be able to try to distinguish whether or not I'm facing burnout, my resilience is taxed, or this is depression and mental health issue, and I should probably go talk to my primary health physician to get some feedback and spend some time figuring out which one it is. We talked a little bit about building up resilience, and what do we need to know about resilience? What do we need to know about building? Two things I want to delve into a little bit more with you. One is, what do we need to know about resilience? And the second is, what do I need to do about the systems? So we talk about systemic, like as a leader, I feel a responsibility to make sure that the organization that I'm creating and the people that I work with day to day, that I am not setting up an environment that is going to create systemic burnout for them. So maybe let's first, let's talk about the first piece first on how to build up resilience and the types of things that really help build resilience. And then we'll go into talking about what we can do about the systemic part of it.
Sure. Well, if I can just twist that a bit, what I'm finding very
Please.
helpful when we're talking about when we categorize different types of burnout presentations, the three I was speaking about, I like to be able to dive into those and look at how you might deal with that both on an individual level, but also in an organization level. And it's great to
Great.
hear that that is your goal as a leader. And in business, there's a phenomenal opportunity because people, if there's a small organization, you might actually be both the person trying to build the resilience in yourself, but also create an environment that might actually be even more effective than, say, a huge organization. Healthcare tends to be a huge organization. There's a person in the one area may have never been in the emergency department, so there can be a lot of mismatched communication there, and we're trying to ease that. But at a business level, there's a lot of opportunity. So we talked about the exhaustion, and we've already talked about some of the individual level, and those are the ones we kind of mentioned before, that you've heard of all of them before. The fueling the body properly, that's the sleep, that's the exercise, that's the food, that's the avoiding unhealthy coping mechanisms. That we know on the individual, that's the to-do list that you knew you were going to get when you came to the doctor anyways. But it's
Right.
also okay, maybe I do have a tendency and I need to learn how to prioritize that, and that's worthwhile. But from a system point of view, what is the culture you are creating? What is the culture you're creating? Is your culture actually somewhat toxic and actually not encouraging that? So, for example, in healthcare, when I was a resident, and we would be on call, and that's when you wear your pager. We still use pagers, and you are responsible for answering calls throughout the night, and you're potentially living at the hospital. You are a resident at the hospital. The expression used to be, if you're only on call 1 and 2, meaning potentially up all night, every other night, you're missing 50% of the learning opportunity. Now that's actually, you're not allowed to make somebody work that much. They had to put a rule in 2003 saying that you're not allowed to work more than 80 hours a week as a resident. And there was pushback. People were not happy with that. So even though you're not supposed to do that, that was the culture. That's the kind of motto that went around. Now that's not unique to medicine. What's going on? What about finance? What about the expectation, the expected hours you're supposed to work? What if your promotion basis is based on billable hours? So what kind of culture are you setting up? Is it one that is not conducive to building resilience? And that might be something that a leader can influence, hopefully role model. So that would be one area, both at the individual and system level. The second one, we talked about that tendency to be quite cynical, to be separate, to have that negativity. That's looking at emotions, your emotional resilience. And that's really important on a personal level, to really remember the importance of solid, meaningful relationships, social support. This can be both in the office as well as at home and otherwise. The importance of good social relationships is so important. We are now looking at it as protective for mortality, for cognitive health. I mean, we are comparing it to smoking in terms of your later health. So importance of social connection is quite strong. We're now talking about burnout. We're talking about work. So looking at your relationships to your coworkers, in many cases, you're at work longer than you are not at work in the waking day. So if you don't foster those relationships, that can be quite a challenging place to work. There's lots of opportunity here as a leader to foster those type of relationships. The Mayo Clinic in healthcare did a research project just trying to find ways to build resilience. And one thing they did, a simple thing they did, was they put in a physician lounge. Just a place to have coffee or some food. And suddenly you had this specialty talking to that specialty, and you're forming all these relationships. And that came out as a very successful, somewhat simple intervention, because now they weren't all in these different silos. They
Hmm.
made these meaningful connections, and it just eased work, and it made for better relationships. So that is the second. And then the third one, of course, is this elusive meaning, this finding purpose, this feeling that you're efficient. Now, we know what it means if you're not performing this the way it used to be before. But a protection of that is this finding your purpose again. And I think that one is the most challenging, because in the first case, I just had a list. Make sure you did X, Y, and Z. Are you doing it? Are you not doing it? The second one, we know what social relationships are. You have to develop them. The third one, purpose can change. What I
Hmm.
used to find quite meaningful at the beginning of my career might been of more evolved with getting this huge amount of information and the excitement of seeing it transition and actually helping people and seeing it play out. After 10 years, still meaningful work. I'm not saying it's not meaningful, but perhaps I need to increase the challenge or try to make it slightly, your meaning can change. What you
Hmm.
find purposeful can change. And that's that whole, I just feel like I'm a cog in the wheel. I don't feel like I'm
Hmm.
making any change. The opportunity for mentorship here from a business point of view is huge. To have a safe space to say, look, I signed on to do this job, and I've done, it's been very, very purposeful, but now I want to shift. And that takes a lot of courage to tell their boss or tell somebody, I need something different, So that last one, it's so individual, and it changes through time, but it's important to feel at the end of the day that you've made some sort of purpose. Now, in healthcare, they did research that even if what you do, if you have 20% of what you do you find particularly meaningful, that you have purpose in 20%, that seems to be protective. So again, it doesn't mean that every single moment of the day when I'm filling out charts, I'm not always saying, wow, this is the stuff, this is what I signed up for, right? But
Yeah.
I might, and on an individual level, it might be quite helpful to remind yourself to do that gratitude, to do that checking in. When you have that amazing interaction with that patient that one day, formalize that, remember that, document that so you can reflect on that. So then if you have a couple of mundane interactions, or you're doing more paperwork or whatever you don't find overly purposeful, you still have that important interaction that you can look back on.
Your 20% number is that was done in physicians, is mirroring research that I read for business leaders, that really that employees need 20% of their work in time to be in a place where they feel on purpose. And I think even when I've read sort of the short articles that I see online on purpose, I think the challenge is they don't make that distinction. They talk about the need for purpose, to connect to the purpose of the organization, to see purpose and have meaning. But it almost sounds like, I should be in this utopian place of work where I wake up every day and I think every single thing I'm going to do today is just I'm going to be just so on purpose. And I think you raise an excellent point. Like that's not a realistic expectation to set for ourselves. We're setting ourselves up for failure. There's Dan Ponifract, who's an author, a speaker, and a researcher, has written a book called The Purpose Effect. And he talks about the importance of finding purpose at the individual level, finding purpose at the team level, and then finding purpose and a feeling of connection to the purpose of the organization overall, and how they're three different things, and that leaders have a responsibility to help to support not just finding that, but making sure that the design of the role for the people that report to us has that purpose built into it, so that there is the ability to feel that on a regular basis, and to be checking in on one-on-ones, to see how much of your time are you actually feeling on purpose, where you're connected to that purpose, so that if a person is drifting into that zone where 20% is becoming 10% is becoming 5% of their working hours, that we can help them to let go of something. Because it's very easy to say, as we mentioned earlier with the Greg McKeown example from Essentialism, it's very easy to say yes. It's very hard to say no. And so if we keep saying yes, we can stack up our day with things that don't feel on purpose for us. And they may be things that other people have sent over to us, and it's on purpose for them.
Yes.
And it's great. They feel great about the fact that we're doing something that's on purpose for them, but for us, we're not living our true purpose. And so I think of the books that I've read on this particular topic, that's probably the most, the best researched and the cleanest and clearest example of how to, as a leader, gain that clarity within your organization. So I'm curious, we talked about the coping mechanisms and the resilience strategies. We talked about, food and sleep and alcohol and physical fitness as being important. Talk about work environment and the system that we're in. We talk about mental health. Tell me about breathing. Tell me about meditation. Tell me about practices that I can, journaling. What are the practices that I can put into my day-to-day that are kind of like simple, easy things? And I guess I realize I'm saying, give me something to do, Gillian.
Where's my to-do list?
And what are those simple practices that I can that aren't time consuming? So I'm not adding another to-do list to my life that's going to make me feel overwhelmed and possibly, continue to foster burnout. But what are some of the simple strategies and things that I can add into my day-to-day that are going to help to keep me, when I'm balancing off my sympathetic nervous system, and I'm breathing heavy in my chest instead of breathing through my stomach and deep breathing? Like, what are some of the strategies that I can employ day-to-day to help me with this?
Yeah. Well, you mentioned breathing techniques, and I talk about this a lot in my clinic.
Okay.
In fact, I have a concussion clinic, and I probably talk about breathing quite often because anxiety and because and so it's not just with burnout, but just as a broader approach. When it comes to breathing, I think my colleagues think I'm crazy because I'm there teaching somebody, Ujjayi breath, and, they hear Darth Vader next door. I do try just what you were talking about. Now, you may be having already understanding sympathetic from parasympathetic, but I do find that helpful to have that education to talk about that with individuals, to talk about
walk us through that. Like, I would love to hear what's the difference between parasympathetic and sympathetic, and what does that have to do with my breathing?
Right. So, well, before I approach that, I often approach breathing from 2 points of view.
Okay.
One is your regular breathing, trying to be more of a prevention. And then the other one is if you're finding you're in that moment, especially with anxiety. Now we're talking about anxiety at that rev up. If we're going to talk about that rev up, that's kind of your physical manifestation. That's your feeling of that sympathetic. Now we have something called the autonomic nervous system, which just means your automatic nervous system. It's things that are kind of going on in the background, whether you know it or not. So I don't say to my blood vessels, constrict now. It's just happening right now. It happens automatically. And that includes our heart rate, our breathing rate, our eye dilation, all sorts of things. There's very little that we can do to manipulate that. So the sympathetic is, we've heard about the fight or flight. That's designed for you to run away from the tiger or fight the tiger, whatever the case may be. And parasympathetic is when you're just relaxed and maybe you're eating and you're just calm. And they dance one up. And there's a whole beautiful process that goes on that helps go back and forth. Now, breathing is our way of being able to slightly manipulate that system, particularly putting us in the parasympathetic. If you are getting that emotional surge, that sympathetic surge, and your heart rate's going higher and you're getting that anxiety, and you engage in that deep breath, that parasympathetic breathing, you cannot disconnect. Your heart rate is not going to continue going up and up. It has to match. And you are going to be able to manipulate more into that parasympathetic mode, which is what you're trying to do. So I try to tell people, instead of taking medication, instead of taking your Ativan, consider this breathing your way to trick the body into that. It's not just tricking, you actually are forcing the body into the parasympathetic mode. You shouldn't be starting that in the moment of anxiety. That is something you probably should have practiced beforehand, because that will be hard to try to now what was I supposed to say? Oh my gosh, I'm starting to have a panic here. But and I encourage people, if you're in a safe place, you're not in the middle of public, if you can make the noise, if you can feel it, and the more stimulation you have, I am cueing myself to go into the parasympathetic, the better. And so those are the deep breaths, and whether you do it through the nose and then out through the mouth, there's different approaches, but whatever you have practiced and whatever you've worked with. So
Let's do one. Let's do one right now. Yeah, teach me. I want to learn from you. Yeah, I'd love to hear. Let's do it right now. So what do I need to learn? You walk me through it.
Absolutely. Okay. So this is more now our deep, deep breathing. Imagine that we're trying to get into more of that parasympathetic. So it's going to be a slower breath. You're going to breathe through your nose, and you can actually hear it. You can almost hear it in the back of your voice. Out. And you imagine it when you breathe. It's not just you have your lungs are quite large. So you have your lungs and you have your diaphragm. So it's almost feeling the different sections of bringing it in. So out. And whether you do 3 or 5 or just kind of settle in that, and you can almost feel, I only just did 2 and I already feel.
Same. Now I noticed when I did that breathing, I noticed something different. So I noticed that you said diaphragm, but I noticed that I first was breathing in, both my chest and my stomach was sort of pooching out at the same time, which is different, right? Like that's not something I would be normally aware of having, as you say, our lungs are big. Mm-hmm. I felt like my whole body was kind of expanding out in that breathing. So is that part, like, is engaging that you're making sure you're breathing in your stomach? Absolutely. Part of that is, okay.
If you're in that more, so your breathing is very high, bring in all the oxygen sometimes. So it is slowing down and bringing that whole area in. Your diaphragm, and I like that you said your stomach, and that's because that's what you actually experience. The diaphragm, of course, being the large muscle that helps. But when you feel in your abdomen, so when you're practicing, so not in your moment, you're already this. When you're lying on your back and you have one hand on your chest and one hand on your stomach, and you can actually visualize, and we teach our children this now in school,
right? And
bring it all in and then back out again. And that's very important. And you can really focus in on that. So you're not just breathing into your upper lung, you're really getting the whole area. Now we cannot go around doing that all day long, hyperventilating, but to have a couple of those to really, and with that noise and with the effort into that, it's a way to bring it in and to calm down. And that's more what I call that emergency breathing, when you're feeling that anxiety rev up. Other breathing techniques are helpful when you're doing more your mindfulness, and that's just bringing it in, and there's lots of and just being present with no judgment, and that's the hard one. It's the learning how to turn off that voice. That is
the monkey mind.
Yes, the monkey. But just laying judgment on things that just don't need to be laying judgment on, just constantly. Right. So to have a mindfulness technique, and I use the word mindfulness, meditation can also be used, but mindfulness, like 10 minutes a day, if that's a lot to start with, but to be able to lean up to that. We now have mindfulness for physicians. We have courses specifically for physicians, not necessarily, hopefully they can share with their client or their patients, but even just for them on their own. And I have taken these classes, and what a great way to make connections across different specialties. And there were people from all sorts of medical practices, and certainly learning lots of techniques, whether that be bodies. Most people have an in with body scans. That's a lovely one to start with, because you're doing something. Mindful walking, and then moving into different layers of mindfulness that work for you. But you don't want to start with 10 minutes. I'm going to sit there and I'm going to levitate, and then why am I not doing this? And then there's a voice saying, why are you doing this badly as well? So, having that. But I've talked a lot about this with my patients, and I've had some very interesting feedback. First of all, now perhaps because we're living in Vancouver, I don't know. I find if I start to bring up some of these conversations, it comes at me. They didn't mention that they are doing this. But when I mentioned these, I'm allowed to talk about this with my physician. And then sometimes just even having a validation that this is something that is very helpful. So it's great to hear that's something you're already in discussion about and that you might even practice. But there's a lot of people who might not. They need to actually be introduced to it, encouraged to it, and even given. Sometimes we give prescriptions for, here's your exercise prescription. This is how much sleep. This is their sleep hygiene prescription. This is your mindfulness prescription. Whatever we have identified on their interview.
It's fascinating. So my mentor introduced me to meditation 12 years ago. It was during the recession, and we meet half a day a month. We have for 16 years, and he said to me in one of our long chats, "I think it's time for you to start meditating." And it started off with guided meditation. It was a meditation podcast I found on Apple Podcasts. And then it graduated into the Headspace app, and I use that for a particular amount of time. The Calm app is another great app that I see. And then a couple of years ago, I ended up buying this little device, which is a Muse, and it is a brain sensing headset. And the cool thing I like about this, and the reason I bought this, it was April of 2018, was I was noticing the difficulty of bringing meditation into leadership development and the resistance to a multi-thousand-year-old technique, to use that to help people to become more mindful, to take a pause, as you say, just 10 minutes a day, to take a pause and to be able to let their brain go into neuroplasticity, to allow all that monkey mind to occur if it needs to occur. And to just help to calm them down. And so I thought, well, I'm going to try this out. The warning I got was, oh, you know what, that's going to be a crutch. If from a friend who's a 25-year meditator, a Buddhist, and he said, well, that might teach people the wrong thing, that they need this device. And what I've learned, I mean, you put it on and you turn it on, and it gives you audio feedback. And it taught me. It's interesting. The founder of the company, I met her in San Francisco, and she said to me, just remember that the goal of meditation is not to become better at meditation. It's to become better at life.
Right.
And I thought, wow, that's an interesting comment from somebody who's designed this device. And what I've learned through using the Muse is I've learned the techniques of breathing and what actually does calm down my mind. I don't self-judge myself around having monkey mind, and it gives you all these statistics, and I'm like, that's interesting. That's where I'm at right now. I did meditate. That's all that mattered, is I did the meditation. So I found that to be helpful. One of the facilitators that I work with at Virtus, Jeffrey Kearney, introduced me to another device that's a breathing device, which he uses, because he noticed when he was in his day-to-day and when he was in front of leaders that he was shallow breathing through his chest. And there's a small little device that looks like a rock. It's about that size, like half a pebble, and it's called a Spire. And you clip it on the inside of your belt loop, so it touches against your body, and it checks to see whether you're breathing through your diaphragm, checking to see if your stomach is moving in and out. And if it's not, it gently vibrates to remind you that you've been shallow breathing. And at the end of the day, it shows you statistics. And during the day, it shows you which parts of the day you were shallow breathing. I was having a difficult conversation in the morning, and you'd be able to see during that difficult conversation, I was up breathing in my chest. Mm-hmm. I had a lunch with a friend. I was breathing in my stomach that whole time. So to be able to train myself to recognize there's certain situations that I'm in my regular day, that can trigger me to going into breathing practices that will raise my level of anxiety. And so I found with, some of these, I'm not a big fan of trying to over app people and have them wearing all these different monitoring devices to be able to do something that for thousands of years people have done without. And if it is something that someone is struggling with, I know that the Muse and then the friend that has used the Spire, they've been incredibly helpful to help to form habits. And that's the thing I think that, as I hear you saying, 10 minutes doesn't sound like a big ask of me. When you say 10 minutes, I think I can find 10 minutes in a day to do a practice that's going to help to support my well-being.
It is a long time to start with, though. Not that you're carving out the 10 minutes, but to be in that, there's a lot of self-judging you can do in 10 minutes if you're...
5 minutes, 3 minutes,
Yeah.
actually, I think is what I started with. And that felt like it was an hour the first time I did.
Right,
So.
right. Yeah, well, sometimes even just having somebody try to measure their heart rate before the breathing and after the breathing. And now I admitted to you, I talked about being on call and using a pager. So obviously I'm in an area that might not be the most latest technology all the time. But, and also I work with a variety of individuals. So I have to be mindful of accessibility and cost. But,
For sure.
but being able to find, like, to have them experience their own heart rate change is quite, it's convincing, I think. I hope anyways. I hope.
Like just as simple as, sort of hands on the wrist or on the.
Exactly. So being able to have that biofeedback is quite helpful. But ideally, if they can, just as we did even with our 2 deep breaths, but that's kind of change, if you tap into that, that's the change, hopefully, that's the benefit that you were looking for. But just going through these different areas and seeing what works for the individuals. Recently, obviously, we're still going through our major pandemic, which has been a lot of stress for everyone, and medicine including, of course. And we would get in the real beginning, when there was lots of questions and we didn't know where we're heading and we were concerned about protective gear, there was just layers and layers of anxiety. We had daily blasts and of all the information, the stats, but at the bottom, there was often mindful tips, little hints of what we as physicians could do. Take it or leave it, it's where you're at. But it was kind of nice to see that there's just somebody putting forward, and that wellness class I talked to you about learning how to do this, that was available for whoever needed it during early on. So that was quite nice to see. But no, there's been more and more addressing. I actually, I work a lot in pain. And there's been a lot of research looking into yoga, and with yoga as a treatment, especially in response to we're in an opioid crisis. And so when we're talking about pain, whenever possible, we're trying to sway back away from dependence on medications. And so a lot of these techniques I talked about were sidestepping from burnout a bit. But yoga kept coming up, and we did a journal club, and we talked about yoga in my class and my group. And that's what inspired a big change for me. Basically, the question came down from a respected older colleague: how could I prescribe something I don't understand? I don't how do you prescribe this? What a great question. So that inspired me to go out and become a yoga instructor and do my 200 hours. So now,
I didn't know that about you.
Yes.
That's great. I mean, that's dedication to research.
But then that was the information that made me feel more comfortable to be honest, I thought I was doing that so I could bring back the information for my colleagues so that we could feel more comfortable talking about it. But it also got me interested in working with yoga instructors themselves. What's their knowledge of anatomy? There's a variety in there. If I, as a physician, am going to start to prescribe yoga, which is now actually a part of our recommendations. It is in the guidelines. It's
really? Okay. That's great.
It's in there. So if I'm now sending individuals to hatha yoga, and is that instructor ready? If they said, I've been sent here because I have ankylosing spondylitis, is that instructor going to feel comfortable with what does that mean? So there's also opportunity to have some interaction there as well. So all these bringing in all sorts of expertise and working back and forth, I think is really helpful. And people can find what helps build their own resiliency. So again, we had that recipe list, and it started pretty prescribed: exercise, sleep, this, that, all the way to this: how do you find your purpose?
Mhm.
which is completely individualized. And I could never tell anybody what their purpose is. And I'm glad that people have different purposes, because what I like to do, hopefully, is different what you like to do. And that's how all these things get accomplished. But we need to have, so there's lots of different pieces here that hopefully will help people build their resilience. But more importantly, involve that organization to support along the way, so you don't feel it's yourself. It's not your job individual. It's your job to take care of yourself in general. That's just being a healthy individual. But when we're talking about work, as I say, and if the house is on fire, it doesn't matter how many downward dogs you do, the house is on fire. You got to take care of the organization, right? So
I love that the medical community is moving in this direction of talking about mindfulness, of talking about breathing, of bringing prescription for yoga into practice. What it does for those of us that are working inside of large organizations with leaders is it gives us the permission to be even more overt in our discussion. A lot of the techniques that we are teaching leaders, we have them built into other conversations. And we don't talk specifically about why we're doing it. But the more that the medical field is able to come forward, it makes it easier for us to introduce these practices for leaders as part of their growth as a leader, not only in building up their own resilience to protect themselves, but also to be able to support their teams. And then for CEOs of organizations to recognize and make space for these practices as part of their culture.
right.
So not as something that someone does after they've burnt out as a reparative or restorative measure, but as part of building up overall resiliency across the organization. I know there's a lot of organizations, the states in the US in particular, that have napping pods and yoga rooms, and they have guided meditation groups that have been put together. They have meditation spaces that people can go to. And I love that that is part of the culture moving forward. We are getting more and more inundated with information every day. And it feels almost like the world as a result of that is accelerating. And that can't be going to a good place. I mean, that feeling of acceleration and of busyness is something that I think is not helpful towards reducing systemic burnout. So I'm just quite grateful for the work that you've done, the research that you've done, and frankly, you took a risk. And I think that can't be understated. That courage, saying to somebody that you need to have courage. Courage is actually the thing you experience after you took the risk, and you have both. You took the risk, you experienced your courage to bring these techniques in, to have those conversations, and then when you got pushback, to say, fine, I'm going to go and I'm going to do further research. I'm going to spend 200 hours in yoga teacher training so that I'm able to not only inform my colleagues, hey, maybe we have another way other than opiates to help to support pain, another way to support anxiety aside from Ativan, as you mentioned earlier in the conversation. And we could bring these techniques in, but also then to realize that actually the yoga practitioners, they're seeing my patients. They're in there in the room and they're asking, as I started my yoga practice the same time I started my meditation practice. And one of the first things I noticed is the yoga teacher said, does anybody in the room have anything I need to be aware of before we begin? And if I gave the answer that you gave, because I don't even know what those 3 words mean that you said earlier as a diagnosis, if I gave that answer, I can guarantee you, unless I happen to have you as a yoga instructor, that I'm going to get a blank stare back. So that education of the patient, as a patient, being able to describe accurately what's happening in my body, and the yoga instructor being able to have enough understanding physiology to be able to say, I would recommend we don't do this pose. We're going to do this pose. When we get to it, I'm going to give you an alternative pose to do, because it's going to be gentler on that area as part of your recovery. I love it. I'm grateful for the work that you're doing, Gillian. And I I applaud it, and I just hope you keep going. And I'm glad that you were able to make the time to have this conversation with me today. And before we wrap, I want to make sure that we've properly covered the topic area. I'm sure we could talk for hours, and I'd love to just check in with you to see, is there anything else we need to know? Is there an area that we didn't touch on, something we need to wrap on that would complete us, or have we done a good job together today having this conversation and talking about burnout and systemic burnout?
I think we've covered it. In medicine, we make sure you've covered the common things. You need to know the common things. We have gone through that. And you can't ignore the rare but extreme things. And we've talked about that. What are the warning signs? What are the I must get help now signs? And so if we've covered both of that, then we've been a good approach,
Wonderful. Dr. Gillian Simonett, thank you so much for your time. I'm Mike Dujardin, and this has been Conversations with Leaders.